I am thrilled to be joined today by Dr. Henry Willis. Dr. Willis, thank you so much for joining me.
Yeah, I'm so excited to be here with you.
Thank you. Do you mind just starting off by giving us a brief introduction of yourself?
Yes, of course. So, hi everyone. My name is Dr. Henry Willis. I'm a licensed clinical psychologist, first generation college student from Jackson, Mississippi, and I'm also an assistant professor and the director of the Cultural Resilience, Equity, and Technology Lab at the University of Maryland at College Park.
Fantastic. How did you first become interested in studying OCD?
Yeah, really great question. So, back in my master's program, before I started to pursue my PhD, I was actually a research assistant at the New York State Psychiatric Institute under Dr. Blair Simpson. And while I was there, I began to learn a lot about OCD symptoms and also OCD treatments. And I also began to see a lack of diversity in the studies in our center, despite us being located in a predominantly Hispanic or Latina community and also despite us being very near an African American community. So this really began to spark my curiosity around how much do we actually know about the experience of OCD in Black Americans, and how might different unique cultural experiences and traditions that Black Americans have might impact the way those symptoms are presenting and even how effective treatments might be. And it also began to have me question whether or not our quote unquote evidence based treatments for OCD are adequately helping Black Americans due to this lack of representation in these research centers.
I'm really curious how this background led you to your current study, and if you could just tell me a little bit more about that.
Yes, definitely. So again, while I was there, I began to really make a lot of diversity initiatives to increase outreach to Black Americans and Black communities in New York. And this really began to also form the basis of my master's thesis at the time at Teachers College, Columbia University, where I began to theoretically explore how experiences of race and racism might be shaping these symptoms of OCD. And I was actually able to test this in my master's thesis at the University of North Carolina at Chapel Hill. And in that study, I was able to show that experiences of racial discrimination actually exacerbated OCD symptoms for Black young adults, but that some form or patterns of racial identity beliefs actually not only protected against the stress that was caused by racial discrimination, but these beliefs were actually associated with fewer OCD symptoms over time for Black young adults. And so this formed the basis of this study because I really wanted to begin to understand the why. So what are the mechanisms? And so this study that the IOCDF funded is a longitudinal study that explores again how these experiences of racism related stress and discrimination might be impacting OCD symptoms, but more importantly, we're now able to investigate potential mechanisms such as things related to psychological flexibility or cognitive flexibility, as well as how my negative cognitive distortions or thoughts might be accounting for why discrimination is associated with OCD, but also why racial identity beliefs might be protected.
It's such important work that you're doing.
Thank you. Yeah, I really love it. Again, this was kind of like my first baby in terms of research and my first kind of line of research. And, even though my research has grown and gone to many different places, this is still a core aspect of not only why I decided to pursue clinical psychology, but it's a core aspect of how I approach science right now as a early career professional.
I'm curious, your research focuses on the Black community and that experience. Why is it so important to focus on this?
Yeah, so there are a lot of different reasons why this might be important. So we know that first, Black Americans in the country suffer from OCD at the same rates as other racial ethnic groups, especially white people. And so we also know that they are also less likely to actually have access to or receive evidence-based treatments for their OCD symptoms. So focusing on OCD in the Black community is actually meeting an urgent public health need to increase access to mental health treatments in this group. This can also help us begin to tackle what we know exists, which is an intergenerational mistrust among those of us in the Black community that have been historically mistreated by the mental health care system.
That's so important. I'm curious, I know that you're in the process of the study right now, but what have you learned so far, and has anything surprised you?
Yeah, so one of the things that's been really surprising in a really great way is that because we began our study right before COVID hit, we were able to sort of see some emerging risk factors that might also potentially be associated with OCD symptoms for Black Americans. And particularly, we began to see a rise in online racism and online racial discrimination, particularly on social media. So we can all remember the summer of 2020, the death of George Floyd, and just all of the negative media that exists around that story and other race-related traumatic incidents that were happening at the time. And so we began to, include in our study measures related to assessing how Black young adults might be exposed to this online form of racial discrimination. And we were able to start to see if this form is also uniquely associated with OCD symptoms. And so we have begun to see in some preliminary findings that these online experiences of discrimination do make OCD symptoms worse for Black young adults. And I believe that this has been, surprising, but also helpful because we're able to kind of keep up with the kind of real landscape of what's happening in society. And we can further improve our conceptualization of all the things that might be happening culturally and socially that Black young adults have to navigate that might influence how they experience OCD symptoms.
Wow, it's amazing how you've been able to respond to the current events and make this so relevant.
Yeah, yeah. And I think a big part of that is to, identifying as a Black American, this is not only just research for me, this is also my lived experience. And so this underscores just my passion for really trying to be a leader in new science and researching things that might be understudied, because we know that in order for our treatments to really be effective, we have to take into account all of these different risk and protective factors that Black people navigate on a daily basis.
I'd love to ask you a follow up about that. What does it mean to you to be bringing this critical awareness to this topic and being a part of really helping us to take a closer look at this?
For me, it really just it means just we're able to put a spotlight on this very understudied area of research. And so back in my younger kind of grad student academic days, again, there wasn't a lot of research that centered the experience or the experience of Black Americans in OCD studies. And so for me, this not only, helps us on the scientific landscape to improve our understanding of it, but personally, I think it also opens doors for a lot of young scholars of color because for me, the first study looking at racial discrimination in OCD was one of the first studies to empirically test these relationships, and it was eventually published in the Journal of Obsessive Compulsive Disorders. And so now that that research base is there, and now that we're still continuing to do the work, I hope that other young graduate students, especially Black graduate students, can see that their voice matters, their questions matter, and their research matters. And just because an evidence base isn't there doesn't mean that your questions and curiosity aren't valid.
That's so important to note. You mentioned those up and coming researchers. I'm wondering what advice you would have for others in the Black community who might be interested in pursuing research as a career.
Yeah, again, I would just really say that just know that your questions and curiosity is valid and it belongs in the space of academia. And also it's important to seek out mentorship, especially mentorship from other Black scholars or scholars of color, because without mentorship from, advisors such as Dr. Enrique Neblett, who's now at the University of Michigan, and also Dr. Jonathan Abramowitz, who's still at UNC Chapel Hill, I wouldn't have had the support to really understand some of the hidden curriculum that goes into conducting science and publishing and doing really great scientific research. And so building that community of mentors, I think would be one of the other big pieces of advice I would give to up and coming researchers.
That's fantastic. That's so great. Thank you. I'm curious, you mentioned Jonathan Abramowitz, and we've talked previously about how he helped kind of facilitate your involvement in the IOCDF research grant program. Can you just share with us your experience with the IOCDF research grants, how you heard about them, and what this grant has allowed you to do.
Yes, definitely. So I've had a wonderful experience with the IOCDF program. And so like I mentioned earlier, my study started right before COVID hit. We actually started collecting data in the fall of 2019. And so when COVID hit, not only were our research activities paused, we also had to just make a lot of different pivots. And this really slowed down the kind of timeline that we were working on. And I really appreciated IOCDF for being really flexible and being really supportive. So something that was supposed to be more of like a 1.5 or 2 year study turned into being more of a 4 year study because of COVID. But IOCDF was supportive along the way, and I'm fortunate to Dr. Abramowitz for allowing me to or helping me learn about the grant that I received because I wouldn't have known otherwise. And then in terms of what it allowed me to do, it really set the foundation for me to have a successful career in research and academia. So, it's not common for a graduate student to kind of get a prestigious grant award like this. And so not only did this help me, navigate my career or really kind of excel in my career, but it honestly gave me things such as early access to designing my own research study and collecting my own data, and it helped me to become independent, probably at an earlier rate than maybe other students who didn't have the support of such grants. And so I really encourage other people to, seek out grants from the IOCDF, especially students, because I think it can be a really amazing experience that can improve the trajectory of your career.
That's wonderful. Well, thank you so much for sharing that. And we're so proud to have you as a research grant recipient. So thank you for being a part of that program.
Thank you. I love being a part of the program, and I've loved my connection with IOCDF.
The feeling is mutual. I wanted to wrap up by just asking you if there's anything I haven't asked you that you think is important to point out or just critical that you wouldn't forgive yourself if you mentioned while you were here.
Great question. I think the only thing that comes to mind is for all those researchers, whether or not they identify as Black or a person of color, but if people are working with Black communities or underrepresented or marginalized communities, it's really important to, one, include those community members in our research activities, whether that looks like having a community advisory board where you can bounce off ideas and get input about the study design or even get input about how to effectively connect with those community and build trust with those communities is important. And to also plan for an ongoing relationship with these communities. And so it's going to take a lot of work and a lot of people to really dismantle this history of mistrust in a mental health care system. And so the only way to do that is to really work alongside these communities and build that trust over time.
So important. All right, Dr. Henry Willis, thank you so much for joining me today. It's been an absolute pleasure talking to you, hearing more about your work. I'm so grateful for the impact that you're having and the important work that you're doing. So thank you for taking the time to share that with us today.
Thank you for having me, and hopefully my story and what we talked about is helpful to other researchers and people in the OCD community.
I'm sure it will be. Thanks so much.